This is the CBS Evening News with Scott Pelley.
It doesn't get much publicity. People don't like to talk about below-the-belt maladies, but bladder cancer is the 5th most common form of cancer in the U.S. More than 70,000 Americans were diagnosed with the disease last year, and nearly 15,000 died from it. New research shows that a big problem may be that almost no one gets the recommended treatment. Here's Dr. John LaPook.
Think it's ready?
Yep.
6 years ago, Adam Schaefer was enjoying Thanksgiving with his family until
I went to the bathroom and there was a whole bunch of red, and it was very scary.
he was just 44 years old. The doctor's diagnosis floored him.
He says, "You have bladder cancer." And you could feel the room spinning.
His first doctor removed the tumor but did not follow up with standard recommended treatment. Failure to follow guidelines is dangerously common, and one reason bladder cancer survival has not improved in 25 years, says UCLA's Dr. Karim Chamie.
If we were to get a report card based on our performance with these guideline measures, I'd say we'd be failing.
For the first 2 years after finding early bladder cancer, doctors are supposed to test the urine for abnormal cells and examine the inside of the bladder every 3 months. They're also supposed to fill it with an anti-cancer drug at least 6 times. But among 4,500 patients, only 1 received that recommended care. And more than 40% of doctors failed to perform those tests even once, the bare minimum.
If we miss the boat, we're going to lose them. These are all potentially curable patients.
Dr. Bernard Bachner from Memorial Sloan Kettering specializes in bladder cancer. He says it's unclear why follow-up is so poor.
This is certainly not acceptable within the medical community. We need to do a better job. There's no question about that.
Schaefer says he's doing well now because he found a new doctor and the right care.
I do credit the team with saving my life.
Bladder cancer that hasn't spread has a 50 to 70% chance of recurring. That's why it's so important to stay on top of it.
John, what I don't understand is, whose responsibility is this? Is it the patient or is it the doctor?
I think it's both, okay? For the doctor, it's tough to keep track of all this, and this is something that a computer is so great at. You put the guidelines in, the person comes in, they have been following the guidelines, little flashing light comes up and reminds you. From the patient point of view, they do have a responsibility, and it's the responsibility of the doctor to have a good enough relationship to look them in the eye and convince them why they should go through sometimes difficult and sometimes uncomfortable and embarrassing procedures in order to give them a chance to save their own life.
Okay, well, thank you very much, Dr. John LaPook. Thank you, sir.